Minister Micheal Tibollo, the Associate Minister for Mental Health and Addictions, joins us for a talk on mental health. It's James with Net News Ledger. It is Monday, the 29th of March. Associate Minister of Mental Health and Addictions for Ontario, Minister Micheal Tibollo, is joining us to talk about the mental health implications in the budget just brought down by the Ontario government. Minister, welcome back to Net News Ledger.
Thank you, James. It's great to be here again and talk a little bit about what we're doing here in the province.
Well, one of the positives for mental health is that we're having, at least in the western part of northwestern Ontario, it's going to be a beautiful spring day. It'll be plus 11 in Minister Rickford's riding of Kenora. I'm sure he'll, like most politicians, they'll take credit for the warm day, but not when it's a 40 below cold day. But the northern part of the province is seeing winter storm warnings and, up to 40 centimeters of snow. March is roaring out like a lion. And what happens when we have, better weather? We get outside more, we get vitamin D, and we get better mental health from the weather. But the important issue is getting good mental health supports, and that's where your ministry comes in.
Yes, and I have to concur with you. A beautiful sunny day, the vitamin D, going for a walk, taking in the beauty of nature, watching the resurgence of life after a long, harsh winter, really does a lot to inspire hope in people. So anyone listening, hopefully you'll get that opportunity to go out and start to see the earth waking up to spring. But in addition to that, I've certainly suffered through a very difficult time with COVID-19. Over a year now, we've had this virus with us, and it's caused us all kinds of issues and problems. The government had made a commitment long before COVID-19 that there'd be an investment of $3.8 billion in mental health and addiction supports. We had started making those investments, and then of course COVID hit. We increased the amount of investments by another $194 million specific to COVID. But I have to say that the budget that was released last week continues on our plan to invest that $3.8 billion over the 10 years, with another investment of $175 million this year, which brings the $174 million, which brings the total investments annualized now to $525 million annually going forward. And that money is basically focused and geared on implementing the Roadmap to Wellness, which was established about a year ago, and the work that we did in December to establish the Center of Excellence for Mental Health and Addictions. So we've set up the ground game and laid the foundations to be able to now expand that system and start to do the work that has been much needed, not only in Southern Ontario, but obviously in Northern Ontario, where there is a huge need for additional supports.
What we get in our part of the province, we're getting, there's always been issues in the north with alcohol. The opiate crisis has been going on probably longer in some cases, and more impact on communities than other parts of the province. And now on the criminal side, we're seeing gangs coming up from Toronto and Ottawa and Southern Ontario because there's more profit in the fentanyl, the crack cocaine, the cocaine. We're watching a total change in the addictions picture from a criminal side. And one of the ones that we find is that a lot of times if somebody decides they want treatment, they want it right away. It's like, okay, right now I've had it with this. And we have a slowdown in the process to get to the next step where there's, full treatment facilities available. What can be done there?
Well, that's an excellent question. It is the fundamental issue that we have in the province, that, we don't have a continuum of care. In 2010, they identified the issues as being a lack of access, a fragmented system, gaps in the system in terms of providing supports. And I remember some of the first meetings that I had with the mayors in Northern Ontario at AMO or at Roma. They used to always say to me, Minister, we need a withdrawal management. Minister, we need a consumption and treatment site. And I used to say to them, okay, that's great. It's something we can do. But then what? What's the next step? What are you proposing? And I could remember in a lot of cases, everyone kind of like shrugging their shoulders and saying, I don't know. We don't know what needs to be done. Well, what needs to be done is a plan. You need to have a strategy that lays out the different pieces that you need to have in place and ensure that those pieces are working together to provide that individual supports through a system that works. But you have to build the system. You have to invest in the people that are going to provide the services. And as you know, you're in Thunder Bay. I mean, you drive 1 hour in any direction from Thunder Bay, and you're nowhere. Like, they're just the vastness of the province. You drive for 2 hours and you start coming into some of the Indigenous communities, and then you start seeing signs that the next town or the next city is 400 and something kilometers or 800 and something kilometers. I remember coming up there and I started thinking, how are we ever going to be able to service all this territory? So we started coming up and I had to be innovative, and we started looking at a hub and spoke model. So we can use Thunder Bay as a center, hire the psychiatrists, deploy them into other communities, and start developing that kind of a system. And one of the things that I'm really proud of in this budget, because I've worked on it for 2 years, I know it will work, and that's mobile health units that are going to be able to leave from a major city, whether it be Thunder Bay or Kenora, and drive into some of these remote communities and have an actual built room on a Winnebago or on a Sprinter that's going to be a place where people can sit and can have that kind of group therapy. They'll be manned by nurse practitioners and social workers, and they'll be able to give education and supports and provide therapy to individuals in need of that therapy. And this is another aspect of how we're going to increase the service to the remote communities. Of course, the other piece that I'm really proud of with our government is the $4 billion that we're investing in the development of broadband, so that no matter where you are, whatever corner of the province you're in, you're going to be able to have access to supports and services. That's going to help our kids with the education and remove some of the frustration and anxiety of not being able to be connected to the rest of the world. It's going to help parents, because again, we're seeing that a lot of virtual healthcare, not just mental health care, but healthcare in general, can be done remotely via telemedicine, via Zoom, or via portal that allows a doctor to speak to the individual. So we're building the system, and it isn't perhaps the perfect system where we have a hospital or a center in each community, but it's something that we can aspire to. But in the meantime, we can't deny people the services that they need in their local communities.
Now that works well in a lot of ways, Minister. But the other side is that after you leave, say, Sioux Lookout, which is about a four-hour drive from Thunder Bay, every community north of Sioux Lookout and Pickle Lake and Red Lake is a fly-in only community or winter roads. So is there going to be option for those vehicles to make it into the winter roads into the communities?
Well, that'll be interesting to see how that gets handled. But the other thing that we're very interested in doing, especially in the remote communities, is developing the land-based healing model. Because again, we know that land-based healing works. I'm looking forward. I have been working with the Minister of Universities and Colleges to develop a strategy to train more individuals in Indigenous healing and combining Western psychology with Indigenous healing, so that we have people trained in the local communities and embedding them in the local communities, so that we can provide more supports within the community. The acute care situation is going to be something that still will require people to have to travel to centers like Sioux Lookout and the hospital there that does a magnificent job. But our work has to be to start scaling up the work that we're doing to be able to provide as many supports as possible that are culturally sensitive right within the communities where individuals live. So I'm going to keep my eye on that particular ball, because it's something that's of big concern to me. Building a therapeutic alliance with an individual requires you to understand the culture, the heritage, the language, and we're never, ever going to achieve that level of care in the Indigenous communities until we train more Indigenous individuals to be able to provide the supports within those communities. So I think we need to work a little harder as a government to make sure that training gets done, and that we have the complement of people we need to help the people in the North, as well as training people in the North to be able to provide services in the North that are not going to want to come down to Toronto, or try to get them to move from Toronto north, because those are typically short-lived, unless someone meets someone up there and they decide to start their family and live in that beautiful part of the province. But that's a very hard way to build a functional system. We need to be proactive and incentivize people. So educating people in the North and them wanting to stay there is a great way to build a solid health human resource that will work for the people in the North.
That's a good step. That's a really good step, and I'm glad that you're talking about, bringing in the people themselves and the culture, because, often in the whole balance point of things, and it doesn't matter what culture it is, once you have that separation from who you really are and who your history and your heritage is, that's probably part of what's knocked a lot of people off balance, between the residential schools and the 60s scoop and all the issues that have been dealt with or are being dealt with and continue to impact people. Moving into that direction is probably very positive.
Well, and I hope to do that. I mean, there's very astute people within the government. Greg Rickford understands the Indigenous file extremely well. He's someone that I go to all the time to understand better what I can do. And the Premier would like to see it as well, that we provide the supports to the populations that then can provide the supports to the people that they serve. And so, having meetings with the various chiefs around the province, it's really interesting because, when you leave Queen's Park in the perspective of downtown Toronto, you realize there are other people that have other perspectives that actually make sense. And, for the longest time, we've driven everything by what we believe to be, this is the way to do something. And it isn't when you get outside of downtown Toronto. So I'm very cognizant of that, perhaps because of my background in my first language not being English, and having spent so much time in other countries around the world and being around a lot of Indigenous people and respecting, the fact that it is a different culture and it's a different heritage, and things that I perhaps say one way are taken, differently, because I don't have the cultural background and the understanding to appreciate the sensitivity of the use of some words. So the more we can do to educate and work with individuals that are going to provide services to their communities, I think the better the community will be served and the stronger we will be as a province.
It's always interesting to me when you think of say, just flat geography. I mean, I call our part of the province, which many call Northwestern Ontario, I think of it as Western Ontario and Northern Ontario, because we are only northwest of Toronto, but we are south of Winnipeg and Regina and Calgary and Vancouver and Victoria. Geographically, we are north of Toronto. We're north of Windsor. But, the big thing that sometimes is hard for people in Southern Ontario to wrap their head around is that our area of Ontario is the size of France. It's huge. And a lot of it is inaccessible by roads. And sometimes what we hear in the north is they would love to see, the premier and a small meeting of cabinet happening in their communities and being in there for a few days to start to really appreciate some of the issues that are faced in the north. Just in terms of, if you go to the grocery store and a 12 pack of pop is $40 in some of the far north communities, that's a real wake up call. If you wanted to have a fresh basket of strawberries, boy, you better go to the bank and get a mortgage, compared to, say, in Toronto or even Thunder Bay. So it's, we have a vast province and we have some real issues there. And so, hearing that there's going to be funding and there's good thinking happening in your ministry is very, very encouraging.
Yeah, those are all very real and relevant issues. I mean, I've not been in a grocery store in Northern Ontario, but I have been one in Yellowknife. And I remember walking in there to buy a bottle of milk. Like, I think it was chocolate milk or something. It was like something like $3, $4. I hadn't bought chocolate milk in a long time. And I remember buying it in a chocolate bar, and I think it cost me just under $10. And I thought, that can't be right. Like it's got to be wrong. And then I realized where I was. So you're 100% right. That whole issue is something that really needs to be looked at in terms of what more can be done to bring, not only food security to the north, but also ensuring fresh quality produce, because again, that's the cornerstone of good health, and it's the cornerstone of mental health. A lot of people don't realize that a lot of chemical imbalances result in the mind not working as clearly or as sharply as it could as well. So those are important issues. But I have to say, if there's an area of the province that's well represented, it's Northern Ontario in this government. I mean, we've got so many ministers from the north that we should be lobbying for a meeting up north. I think it would be an amazing thing to do when we eventually can have meetings again, because right now, most of our meetings, actually all of our meetings, other than the cohort that sits at Queen's Park, they're all done virtually. So I haven't seen most of the cabinet ministers for probably since Christmas, and we're cabinet. So when we meet 2-3 times a week, but unfortunately, this COVID-19 has really cramped our ability to visit. I'm actually hoping right now, if things go well, to come up to Thunder Bay sometime towards the end of April, and hopefully we'll get an opportunity to do this live and have an in-person meeting.
Yes.
But it's hard. It's frustrating for all of us. I was talking to a good friend of mine yesterday, and he called me to see how I was doing, because I've noticed my fuse is becoming shorter when it comes to certain things. And I started realizing I haven't had dinner with any friends for like 6 months. So the only people I ever eat with anymore is my wife and kids. And, not that I have anything, against them, but, when you've had no other contact with another adult or anyone your own age, another man your own age, just to talk about, I don't know, things that we would talk about as guys, tell a joke. When you think about the weight that has on all of us, not just me, but all of us, the fact that, we're cooped up inside. I came out this morning and I'm looking around, I go, wow, it's cold. The last time I came out, and I'm trying to think, was Friday at noon was the last time I'd come home to get into cabinet. And I never went outside. I spent 2 days of my life inside my house. So that to me is really frustrating. I mean, the weather was terrible, so I didn't miss much from the weather. But just to think that I didn't socialize with anyone, I didn't go into a store, I didn't see anybody to say hello. I basically just sat at my desk or sat in front of the TV or sat with my immediate family. Boy, does that take a lot away from who we are as human beings, right? That to not have any of those contacts or relationships or ability to just shift gears, and that plays havoc on our minds. It hurts the best of us. So, while routine's important, I think we've got to start breaking the routine of cocooning and going for a walk, maintaining the physical distancing, taking appropriate care with masking and everything else, because these variants of concern are really concerning. We're seeing the numbers coming back up. I think you're going back into lockdown up there today.
We've been in lockdown.
You've been in lockdown.
Yeah.
This is I love to go to Manitoulin Island, and this is right now, I think, as the ice starts to break, it's the run of the smelt.
Yes.
And it's 2 years. I've got everybody wanting to go smelting, and none of us can go because we can't get together. But I almost wanted to make a run up to Manitoulin this weekend, and then they're in lockdown and Sudbury's, and then I don't want to be the guy that brings it to Manitoulin. Like, could you imagine what a disaster that would be? Or bring it back to Toronto and something happens at Queen's Park and I shut down the legislature. So here we are, cocooning, another 2 days inside to make sure everybody stays
I'm noticing
safe.
that I noticed that with the grandchildren specifically. We're getting outside as much as we can, but when we have our weather challenges, off we go, and we end up with how much time spent in front of a screen that's healthy for an adult. you know, and that's the business I'm in. And I mean, how many hours a day are you spending on Zoom? So there's a lot of change coming. And I'd like to, you know, continue the conversation with you as we keep working forward. We've been having a good discussion for those of our readers and viewers, and we'll put the links to our earlier discussions in the on here for our YouTube, so that you can keep following what we've been talking about, because this issue of mental health and addiction for our region is just critical. And I want to thank you, Minister, for taking the time this morning.
James, anytime. This is great. And, you know, everyone stay safe. Enjoy your grandkids, enjoy the weather, enjoy the you know, the some changes. We have to maintain our routines, but enjoy some of the changes as well, because that will refresh the mind. And you know what? There is hope. We are going to get through this together.
Thank you.
Thank you.
To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.